My name is Bianca Grimshaw, Athletic Trainer Coordinator at U of L Health Sports Medicine Institute. Growing up, I played sports in high school, knew that I wanted to stay within the athletic realm, but knew I wasn't going professional by any means. So in a combination of providing patient care and still being involved in the athletic competition or that team atmosphere, that's how I found my way into sports medicine. Athletic training is actually very unique, where we focus and have an expertise from a problem-solving standpoint of recognition, prevention, assessment, management, and rehabilitation of injuries, not just for the athletic population. And so that's what's really important for me as the athletic trainer coordinator here, is to really promote and educate everyone on what athletic trainers do in enhancing healthcare in general, not just for that athletic population or someone you may think is just in a jersey, because our patient population extends to an adolescent athlete, maybe a middle school player, or it may extend up into a middle-aged or older individual who maybe had a history of athletic competition, but now we're following up post that time frame, and there's a lot that we can still help and promote in that regard as well. Training a fellowship at the Andrews Institute, Dr. James Andrews always said the patient is always right. So I've taken that mindset as well in making sure and providing that best patient care. Well, I think for myself, just from the bigger picture standpoint, usually when you think about an athletic trainer, it's that image of someone being on the sideline with a team. And so I started off in that route, covering whether it be university, middle school, high school, but then transitioned, especially in that fellowship experience, to being that behind the scenes clinical care, physician practice style care, and then have moved into the OR experience and setting too. So in my position here, I'm able to see the patient day one in the office, talk about the initial injury or the initial concern, and follow them through the entire process of their care, and continue that process and building that relationship with them through the entirety of that behind the scenes aspect. Actually, a lot of people don't know that I'm from upstate New York, and it's actually a very small village in New York. So when I do mention that and have mentioned that in the past, they think, oh my goodness, the city, so Louisville must be small. Louisville is actually the biggest city I've ever lived in. So it's been a different transition, just not having, say, the Adirondack Mountains nearby, but taking advantage of the gorge and some of the hiking that Kentucky can provide as well.